Welcome to ClinArk Talks, where we have discussions about community health and clinical trials. Today, I am pleased to welcome Juliet, a sickle cell warrior from Miami, Florida, to tell us about her journey and what it's like living with sickle cell disease. So we can go ahead and dive right into it. Juliet, tell me a little bit about yourself, what it was like growing up with sickle cell.
Hi, Adam. My name is Juliet Romeo. I am a writer and director. I directed a short documentary on sickle cell called Jules, which stands for Just Using Life to End Sickle Cell. And it has won several awards and been on PBS. And it was really a great opportunity to be able to build awareness and shed some light on this disease. And I've been an advocate and warrior for many years, so I was proud to do it. What's it been like growing up with sickle cell? It was tough. I had to, I had a lot of crisis when I was young. My mom was taking care of me, and it was just me and my mom and my grandparents. And it was tough because we didn't know anybody else with sickle cell. And my mom didn't really have a lot of community support. There weren't a lot of like sickle cell foundations back then and places that she can go and discuss that. I'd never even met another sickle cell warrior until I was like an adult. So yeah, it was tough. It was hard going to school and trying to catch up with my work a lot because I was in the hospital a lot. But yeah, so, but my mom and my grandparents, they did a good job taking care of me.
Now, I've heard a lot of discussions, about, the challenges with transitioning from pediatrics to, becoming an adult and finding care and all that stuff. So what resources did you use to, find adult providers?
Well, honestly, I personally feel like those resources still don't exist. I mean, there's still so much more work to get done to really help warriors transition from pediatrics to adult. And there really isn't anything solid right now. I feel like sometimes, like for me, luckily I have a primary doctor that really cares and understands about his patients, and he treats the individual patient and not the numbers and labs and the chart. And so that has really been beneficial to me. But before I had that doctor, I went through many doctors trying to find someone that I trusted, someone that understood what I was going through, and just didn't really make it about themselves or make it seem like they weren't really interested in what I had to say as an individual. So it really takes a lot of work to really, take your time and decide to find a doctor or just healthcare providers as a whole, even, your hematologist, your pulmonologist, we have all these other doctors we also need to see too, specialists. And it's important that they understand and know as much as they can and willing to learn more about sickle cell.
Mm-hmm. So what have been some of the toughest challenges that you faced due to, due to having sickle cell?
I mean, I've had a lot of tough challenges, Adam. I mean, really, from relationships to employment, it's been difficult. But I would say one of the biggest challenges I had was trying to graduate college. It took me twice as long to graduate after, leaving high school, because I really didn't have any support from the faculty and staff at my university about my disease. And I needed to find a school that understood that I needed to be part of the disability resources department. And that was difficult I went to a few PWIs where they just looked at me and didn't really understand that I had a disability that required for me to be eligible to be in a program like that. Right. And so when I finally did find a university that was interested in supporting me and supporting what I was going through and really helping me to graduate, I was able to graduate with a 4.0.
Wow, that's impressive. Wow. So one of the things that I also hear is that people with sickle cell face a lot of stigma. Have you experienced this throughout your life?
Wow. Lots of stigma. I mean, I've heard that the myths that we don't live until, we'll die soon. We can never have children. With drug seekers. I mean, I feel like a lot of these negative aspects, just have people believing that we don't have a quality of life that we deserve. And then sometimes we even feel that we don't deserve as much if, doctors are already looking at us like, well, you're not going to make it anyway. So why am I putting the effort in? Like, they don't have to say it. It's kind of like just in the little things that they do or don't say and do that make you feel like, they don't want to spend the time on us. And so a lot of those stigmas, I mean, they're really damaging. But I try not to focus on that. I know, I'm a believer, and I believe I have a purpose and a journey. And despite what's going on physically in my body, I know that even that is a part of my testimony.
Mm-hmm. Absolutely. So just to kind of piggyback on what you said, people misunderstanding, individual sickle cell. What would you say to those people that, do misunderstand individuals with sickle cell? What would you tell them so that they understand what it's like to be in your shoes?
Yeah, take a moment to understand us and to empathize. And we're all different. Like, you can't assume that my pain level is the same as someone else's, or I knew someone with sickle cell and they didn't complain about that. So, I mean, we're all different. We all have different ways of handling our pain, and really just being patient and really, again, putting yourself in our shoes. Like, I've had so many people ask me, what does the pain feel like? It probably feels different, but as intense for everyone. And in different areas of our body, and sometimes all over, all at once. And so I feel like if people just understood, I think pain is such a abstract thing. I mean, look at like women in childbirth, and men, they could never understand that pain that a woman goes through. Yet we have to go through it, and then, and we handle it. If, I've seen studies where we try to emulate the pain of labor and childbirth, and men are like falling apart. So, no gender bias, just saying, You know what I mean? So I just feel like empathize, understand that, I can't imagine what you're going through, but, just to consider what my worst pain is like and multiplying that would make someone think, well, gosh, Lee, if, that one time that, the car ran over my toe, if I multiplied that pain times 100, this is probably what, my friend or my family member is going through.
Right.
And, just showing some care and concern, how you would want someone to treat you.
Absolutely. Absolutely. So, I won't keep you too long, but, I know that there are a lot of people out there with sickle cell that, deal with trauma just from the pain, and they probably need some inspiration. So what are some words of inspiration that you would like to share with others that have sickle cell?
I think it's very important for us to share and to have people that we can talk to. Find a group. I recently started reaching out to people on Clubhouse. Shout out to Clubhouse. It's so awesome. And just being able to speak with other sickle cell warriors there and find out that we're also different, but we're also so much of the same. And then you don't feel as alone. And also, I feel like people say it so much, being an advocate for yourself. And I feel like advocacy is such for me, it means helping outward, not inward. You know what I mean? So it's like, if I see someone, I want to advocate for them because they don't have a voice for themselves. So when someone says advocate for yourself, it just seems so weird and like an oxymoron to me, because it's like, you're supposed to look out for others. But because sickle cell has just seemed to have been ignored for so long, we have to be advocates. So I feel like instead of using advocacy, let's talk about being diligent in your own healthcare, making sure that you're, being brave enough to say, I'm not okay today. I know I have this habit. My doctor's like, hi, how you doing? And I'm like, I'm all right. And it's like, well, why did I just sit here then? Why did I make this appointment if I'm all right? So it's just like a habit. And so, it's like the reflex to say, I'm okay. And I'm not. So try to just remember to say, well, what's going on? How you're feeling today? And ask questions and be adamant, even if they acting like, well, you'll never get it. We usually know our body better than anyone else. So, be adamant. I know sometimes we have to be so strong that it seems like we're being difficult. And if someone thinks you're difficult, that's their problem. You have to really stand up for yourself and continue to be a warrior.
Absolutely. Absolutely.
Yeah.
Well, I want to thank you so much for, joining and sharing your story, your journey, and, giving people, perspective and a better understanding of what it's like to live with sickle cell. Thank you for joining, and I hope you have a wonderful day. This episode of ClinArk Talks was sponsored by Forma Therapeutics Hibiscus Study. Forma is currently seeking sickle cell warriors in Miami for their newly launched study. This study kicked off last month, and anyone interested in learning more is encouraged to consult with their physician or reach out to Advanced Forma's research site by calling 305-220-2727 or by visiting advancedpharmacr.com for more information. You can also email us directly at ClinArkTalks@ClinArk.org. Thanks again for listening, and to our sponsor, Forma, for their work in sickle cell disease and increasing clinical trial access within the community in and around Miami. Thank you.